Hey, welcome everyone. My name is Tristan Claridge. In this session, we welcome Dr. Ester Villalonga Olives for a presentation and discussion about the measurement of social capital. Ester will talk about how to collect data on social capital using questionnaires and the challenges of measuring social capital, which I think for everybody is something that is an ongoing challenge. Ester is a social epidemiologist who holds a PhD in biomedicine with specialities in epidemiology and public health. She is an assistant professor at the University of Maryland School of Pharmacy. Ester's research interests are related to the study of social determinants of health, with an emphasis on social capital, health inequalities, and a focus on the design of health interventions. She has a background in psychometrics and has worked with patient-recorded outcomes, especially health-related quality of life, and has developed a patient-reported outcome to assess bridging social capital. Her work is also centered on the investigation of the relationship between social capital and health outcomes, with a focus on underserved and vulnerable populations such as migrants and children. So Ester's certainly worked with social capital quite a bit, and she's going to talk with us today about how we can measure social capital. Over to you, Ester.
Thank you, Tristan, for this wonderful introduction. Now I'm not sharing my screen, right?
Yes.
So let me try again. I don't know what happens, but it's the first time this is happening to me. I always see, so I can share my slides and also see the faces of people. But today, this is not allowing me to do that. So I think now it's working until I press something and it's not gonna work, so. Okay, here we are. Well, Tristan gave you some information about me already. So my training, so I'm a sociologist, an epidemiologist, and I have studied public health as well. I'm very interested in patient-reported outcomes, and I do a lot of research on the social determinants of health. And here it's where the social capital has a role, right? So in the past, I have been very interested in developing and adapting patient-reported outcomes. And I have been very interested in social capital and basically the relationship of social capital with health-related outcomes such as perceived health and cognitive decline or quality of life. And I have done a lot of research on children at the beginning. Now I'm more concentrated on older adults, and I'm super interested in immigrants as well. So I have a concentration on vulnerable populations. And with these two different hats, like the hat more on social capital, social epi, and my other hat, which is more related to measurement theory and the development of patient-reported outcomes. Now, so I have been very interested for the past few years, and well, in surveys, in tools that are using social indicators, like the final outcome is to evaluate a social indicator, and it's where I have been very interested in, well, how do we measure, for example, social capital, which is related to the social determinants of health. And I believe we can use some of the techniques we use for patient-reported outcomes to think about and reflect on how we evaluate social capital indicators. So let me ask you a question first. I want to know from you that are part of this talk today, how have you measured social capital in your research projects, and which indicators have you selected or used? So anyone that want to share anything about this, please. Let's start here.
Okay, I'll go first. This is Mike Ryan. I'm from Huntsville, Alabama. I'm a part of the graduate school of human educational development from George Washington University. I'm a doctoral candidate, and I'm attending this video. I'm doing my dissertation on the construct of social capital, and primarily what is the value of social capital to government program managers. All right. So the graphic I'm looking at, the target group And I'm looking for ways to measure social capital. All right. So I'm here. This is investigative work. This is actually research. So I don't have a whole lot of collaboration or that I can provide on ways that I have measured social capital in the past. I'm looking for ways.
Okay. Okay. Good. So I hope that this talk is going to help you a little bit think about how you evaluate the social capital indicators. I see another person trying to talk. Please go ahead.
Hi, everybody.
Hello.
Hello, you can hear me?
Yes.
Yes.
Okay, good. I'm Florence and I'm from Ethiopia. My PhD dissertation was on social capital. Specifically, it was an assessment of social capital in rural Ethiopia.
Mm-hmm.
So I have used generalized trust, particularized trust, norms of reciprocity, participation in civic association, as well as social networks as an indicator of social capital. And I try to assess their distribution across socio-economic across different socio-economic groups in rural Ethiopia. So this was my research project on social capital, and this was indicators that have been used to assess or to measure social capital.
Okay, good. So I keep this in my mind. So anyone else that want to share how they...
Hello.
Yes.
Hello to everyone.
Hi.
Hello.
Hello.
Yes, I'm Patrick from Kenya.
Hi, Patrick.
Fine, of course. Good evening. It's the time in Kenya. Now, I've borrowed so much from the World Bank measure standards in my project, in my PhD project, in which I was looking into the contribution of social capital on sustainability of women enterprises along Lake Victoria. That is, to what extent is social capital contributing to their sustainable business or fish business enterprises? Of course, they are small-scale fisheries. Now, the constructs or the measures of the social capital adopted are, one is networking. The other one is collective action. And the third is information sharing.
Okay.
I've majorly borrowed from those measure standards or constructs or variables that have been recommended by World Bank. Thank you.
And so there's a couple also in the chat. Shirley's saying that measuring by asking neighbours if they know their neighbours' names. David's indicating levels of trust in networks and how easy it is to share or access resources. And also another one, Claire, are saying, asking whether participants have a best friend, a romantic partner, and those kinds of questions. So there's a variety of different perspectives coming out.
A variety, I like that. So let's, yes, please.
Hi, can you hear me? Yeah, I just want to add to Dr. Tamarat and Patrick about, the use of social. I also did use social capital for my dissertation research. And, I had to, I needed help that time, right, to do it. And so what I realized is that your indicators is very much affected by the unit of analysis. In my case, I was doing a household, which is really like an individual, and that determined the type of indicator that I had to use to measure social capital. So social network became the proxy for measuring social capital because of my unit of analysis. But if you're looking at the community level, then I think your indicator would be different.
Yeah, I agree with that. But let's think about all the answers you gave me. And there's a variety of indicators here. And I wanted to know, what do you know about the development of these questions? So my question here is, have you asked yourself about the population target of this question. So when these questions were developed, when a tool is developed, usually we have a population target. It can be immigrants, it can be people that are 65 and older. So the population target is it's very important here, and you will understand why in a couple of minutes. So has anybody conducted any psychometric test to evaluate the performance of the tool when you got the data? Or in case of trying to collect the data, did any of you run any qualitative evaluations with potential participants? So because we have different scenarios here. One scenario is maybe you get data and you want to see if the data works well, right? But some people that do not have the data, they have to implement the survey or administer the survey. Well, one way to see if it works well, if it's going to work well, it's to run some qualitative methods first and analyze the data before implementing the survey to a larger sample. Who has done this? So please tell me, what's your experience on these different scenarios? Who wants to start?
Okay.
I think go ahead, sorry.
Okay, I did run a qualitative evaluation. As I told you, my dissertation was on the assessment of social capital in rural Ethiopia. So to test some of the tools, to test some of my tools, I have run a qualitative evaluation and I have got a good feedback. Maybe I will come back to it later on. But for example, I can raise the issue of the indicator for generalized trust. There is a common question that we have asked, is that do you generally trust people in general, and so on and so on. So for this question, I've got a very different feedback.
Okay.
Than it is supposed to be measured.
Okay.
So I was forced to reformulate or rephrase this question in my case. This was a standardized question, but after the qualitative evaluation, I had rephrased that question.
This is very important. Keep it there, because this is very important thing. So who else wants to share experiences about these topics, these questions?
It's Williams here. I had a target group which was contemporary project managers in contemporary, and what I did is I ran a pilot questionnaire on them to ascertain particularly their understanding of the topic and what sort of questions they felt were clear for them and unambiguous for them to respond back on. So that's why I had was measuring things like level of trust and how they felt, how well they felt connected into the network, and how easy it was to share resources.
Okay, very important. Ana Lucia, I see another person raising the hand. Ana Lucia?
Yes, thank you.
Yes, please.
Hello, I'm from Ecuador. I'm working in public health also, and I really like what you explained of your background. I would like to have some exchange with you. I have run a questionnaire with families or mothers, especially from under 5 kids, indigenous kids in the highlands of Ecuador. We want to know what were those determinants that associate better with malnutrition. So we start looking for different questionnaires that have been already validated, and we found especially questionnaires related to poverty and also agricultural outputs. So it was hard to find something that make the link between health outcomes and how to measure social capital. The other problem that we found here is that social capital was related to the household and not exactly, well, we have to look at a direct way of measuring that, not the social capital of the under 5 kids, but from the mother or the household. So we have some difficulties. We include in this survey some questions about social capital related with social participation in different community activities, the time that they have to take care of communitarian activities. But at the end, we found that it was not highly associated to malnutrition. I think that it was because of the tool that we used, but okay. I still have this big question how to measure that.
So let me ask you a question. You said something very interesting, which is that the tool was validated, but the tool was validated. What do you mean by that? So what was the population target of the validation? And what was and there were any differences between the population target of this for the validation and the population you ended up using it?
I think it has to do more with the big area of study. The population was more or less the same, indigenous highland population, but it was not related to health outcomes. It was more related with agricultural and participation areas.
Okay. So I think you all gave me very interesting answers, and this is helping me to understand a little bit like the experiences of each of you measuring social capital, right? So, and here I have Tristan, our wonderful host, has a very nice website that you all know for sure, where he talks about social capital and different topics related to social capital. And what I did was to check a little bit about what he was saying in the piece on measurement. And I think it's very important to read this couple of paragraphs before we continue. Social capital cannot be measured directly, but can be inferred from its powerful effects. Since we cannot measure social capital directly, we measure it by using indicators or proxies that are theoretically linked to social capital. Unfortunately, the choice of indicators and the method of data collection has often resulted in questionable validity. In the past, authors have taken a single or a small set of indicators to represent social capital. And here it's what I see a lot, right? A comment here on validity. So I believe the most important, because probably you are aware of the different types of validity that exist. But one type of validity that is really important when we are implementing a survey or when we are developing a survey is content validity. The content validity is the one that it's really, if you have a questionnaire without content validity, it's not gonna work well with the population with your population target. And content validity is the extent to which a variable, a rating scale, a questionnaire measures what it is intended to measure. But what's the problem here? It's very, very specific to a population. So to make sure that the questions we use are appropriate, understandable, and meaningful, we need to involve potential participants in the development of scales and experts in the field to assess the content of the scale. So to me, it's a long process involving different actors. You need potential participants of these questionnaires and you need experts as well. And I believe when I was checking the webpage from Tristan, so I saw a list of scales, a list of questionnaires, tools that we all know, and some of us have used some of them. But I wanted to ask Tristan if you can just briefly tell us, what do you know about it? So have you seen any of the scales that, how can I say this? So what do you know about the development of the tools? So are they specific to certain populations? So can you tell us a bit more about the list if you can, if you know more about those?
Yeah, sure. So this list came about from a survey of peer-reviewed literature published after 2019, and I sampled 250 such articles, and I looked at what definition was used and a variety of other things. And one of the things I looked at was the methodology that was used and the survey instruments that were being cited for the development of the survey. So of the 250 articles, about 74.5% of them were quantitative to start with. So about a quarter were either qualitative, mixed method, or in fact didn't involve empirical research. So of that 75%, about 113 used their own, developed their own, used an existing instrument. So they borrowed from different existing instruments, and 67 developed their own. So clearly developed their own questions and didn't cite any existing literature for the development of their survey. And I found a total of 124 different instruments were cited. And what I found overall was a lot of people were selecting individual items from different instruments. So perhaps instruments that were developed for measuring trust or for measuring belonging or various other factors. And of course, there were the social capital instruments as well, such as some of the popular ones. There were things like the social capital questionnaire that was developed in 2000. But there was a real mix there. 124 different instruments were cited across those 113 different articles that used existing instruments. So a huge amount of variety.
Okay, well, this is super interesting. And so what I did was to run some analysis. Full disclaimer first, I'm not a biostatistician. I always work with biostatisticians, okay? And they are the ones that help me to, I identify the research questions, and they help me, of course, they give me some support to answer those research questions. So here, what I had done, and I think this is gonna be something very interesting to you, is that if you would like to understand more about how some items perform that have been related to social capital, one tool we have that I think is very helpful is item response theory. Item response theory, I don't know if you have been exposed to that. To me, it's fascinating. Item response theory, it's something that if you don't know about, please email me and I'll be happy to send you some papers or a couple of references for you to understand a bit what is it about. But my objective today, showing you the results of this preliminary analysis that I'm using as preliminary data to justify future work, is to suggest you that not all questionnaires can be used with any population. And now you are going to understand very well why I'm saying that. I don't know if so part of IRT, these item response theory method, it's part of the, this is part of modern psychometric techniques, and part of the IRT method, we evaluate differential item functioning. We call this DIF. And we use DIF to test the functioning of a scale, a questionnaire, a tool, or single items, okay? So here I'm gonna use scale, questionnaire, or tool indistinctly, okay? So, so in general, an item displays DIF when study participants from several groups who are equal on the latent construct have unequal probabilities of a correct response on the studied item. So when I talk about groups, I mean groups such as racial groups or age groups or groups of people based on SES differences, okay, or gender differences. There can be multiple groups here. And there are two types of DIF. One DIF is uniform DIF, and uniform DIF occurs when the group difference in the probability of endorsing an item stays constant over the distribution levels of the latent construct. But there is something more problematic, which is non-uniform DIF, that is more it can be a function of the latent construct that an instrument is designed to measure. So the difference between the two groups is not constant, and many times we observe an interaction. So you will see this better in the graph. And here, when I say latent construct, as you probably know, is an underlying construct that is not directly observed or measurable. So here, social capital would be this latent construct. We have several indicators that are measuring this latent construct, which is social capital. So, and here in this slide, probably you have seen that I'm concentrated on racial groups. Okay, so I have been very interested in observing differences of how Blacks and whites respond to items differently. So this was my topic of research when I started to look into this information. And I have been very interested in this because I live in an area where there is a mix of people. So I'm from Spain. So in Spain, the racial differences we are quite homogeneous. But here in the US is kind of different. So when I moved here, I was like, wow, now that we are collecting data, maybe we have an issue here because, we do have different characteristics, right? So here what I did was, so DIF was assessed using a two-group comparison, whites and blacks, and a four-group comparison, which I'm going to show you later in next slide. In the four-group comparison, what I do is to include education. So I have four groups: low education being white, low education being black, high education being white, and high education being black. And I performed two models. So with my co-authors, we investigated DIF for 3 social capital indicators collected in 2004 in blacks and in whites independently of their educational attainment. This was the first model. And after we did the same, but considering education, because you know that, here, education and racial differences, they are very correlated. So I wanted to have these different groups here. And I put here the items. Probably these sound quite familiar to you. So people in my neighborhood are willing to help their neighbors, belonging to my neighborhood, or people in the neighborhood can be trusted. It's important to say that here that higher scores indicate lower social capital and the reverse, okay? Here, the graphs you have here. So you have the two group analysis first. If you check the part on belonging, sorry, because I was pointing the other screen, so I don't. So here, please concentrate on this one here. In the item belonging to my neighborhood, whites have higher levels of endorsement of the disagree and strongly disagree options compared to blacks when having the same low levels of social capital. In the item, people in the neighborhood can be trusted, which is this one. So concentrate on this piece here. When I check this one, blacks have higher levels of endorsement of the strongly agree and agree options compared to whites when having the exact same levels of social capital. However, whites have higher levels of endorsement of the strongly disagree and response option than blacks when having the same low levels of social capital. And so if you check the graph, the magnitude of the differences do not look extremely large, but there is no uniform DIF. And this is telling us that this DIF is problematic. So here there is an interaction, okay? Here the red curve is lower and after it's higher, and the reverse here. So, and this is an issue. But things get more complex when analyzing the 4-group model. So here it is, so we created 4 groups because I told you that we included educational attainment. And in this case, in the item belonging to my neighborhood, which is this one, the red and blue curves overlap. So this indicates that the groups that have lower educational attainment have the same distribution. However, the distributions are different in the groups with higher educational attainment. Whites with higher level of education have higher levels of endorsement of the disagree and strongly disagree response options than blacks when they have the exact same level of education and the exact same level of social capital, sorry. And these differences do not look extremely large, and diff is uniform. However, again, the part on trust, so the one below this one here, it's more complicated. So the blue and yellow curves overlap, and the red and green curves overlap. So this means that blacks and whites, independently on their level of education, have different levels of endorsement of the response options when having the same levels of social capital, same levels of trust. And larger diff is observed in blacks, consistently having higher level of endorsement of the strongly agree response options compared to whites, and whites consistently having higher levels of endorsement of the disagree response options compared to blacks when having the same levels of social capital. So this means that, well, this item shows uniform and non-uniform diff when considering education in all groups. And this is very problematic because rather than finding a consistent advantage of one group, we observe an interaction indicating that diff size may vary from one category to another within the same item. So in this study, you can see that I selected 2004 because I was like, well, it was the first time this information was collected in MIDAS. MIDAS is the midlife in the US panel data, is a follow-up survey. And so I wanted to analyze first what was going on in 2004. And now what I'm doing now is to concentrate on observing changes. Why? Well, there can be changes in neighborhood composition, of course, that lead to different answers, but not only that, some concepts may not be meaningful for a certain group anymore. So, for example, I believe that social capital indicators such as trust or belonging to certain groups may be very meaningful for whites, but maybe not for blacks. And that's why we observe these kind of differences. So I'm asking myself, what do a white person with a higher educational level understand, or how these people respond to this question compared to a black person with a lower educational level? I believe this depends on your experiences and what you value in terms of trust. So that's why maybe we are collecting data here in the US and we are trying to compare blacks and whites responses, and maybe these responses are not even comparable. So we talk a lot about health inequalities, but I observed that there are questions we use that were developed mostly in white samples in a very specific region in a specific language. And we have exported or imported those questions. And this is something that Tristan just talked about. Some people get some items, they are like, oh, let's translate this and implement this here or there. Maybe there is diff because there are regional differences, or of course, a language is an issue. So you need, when you try to collect data in a different language, it's very needed. So a cultural adaptation is very much needed. So you cannot like implement something without thinking about cultural adaptation. And it's very important to say that diff can be observed comparing other characteristics of the sample under study. So it's very different. So sometimes even boys and girls or women and men respond to questions differently. We know that about depression, for example. Women respond to depression items in a different way compared to men. This means that sometimes and we need to identify which questions do work differently, because if we want to compare the scores, probably they are not even comparable. So this is the first thing we need to think about when measuring social capital. And probably you wanted to hear about solutions of your problems, and I'm giving you even more problems that you expected, right? So here, just a summary of what I state. So I prepared for myself, okay, this is, and here you have sample sizes and so on. This is work in progress. I haven't published this already. So I haven't published this yet. Hopefully I'm gonna publish this soon. But this is more or less, here you can see a bit a summary of the results, okay? So now, let me ask you a question. If there is diff, I gave you some answers already about this, but why do you think this is happening? And do you think this can happen in different scenarios, or in some of the items you have imported, you have used and borrowed from other questionnaires? Do you think diff may be an issue in your studies? Who wants to answer this? Who wants to take the lead on this now? Ideas. I don't see the chat, so I don't know if anyone is saying anything.
Yeah, yes. I think it's possible that, you know, in some situation, in my case, I did my research on a post-conflict community where social capital, you know, somehow, you know, was undermined by, you know, decades of war and things like that. And I customized all my question to capture that perspective. But as far as the intervening factors, especially in the case of the United States, I think if we are looking into comparing, you know, a population like Black and white United States, I think we would have to go deep into the history and the culture, because social capital too is not separated from the culture of, you know, cultural capital. That is, you know, the way people perceive relationship is different. Yeah. So I think that is where we can have some experience, especially when we do the, you know, the statistics and things like that. It become more difficult. You know, we start to question what are some of the intervening variables that are not, you know, taken into concept or control for.
I totally agree. And I believe it's exactly what you, so based on your experiences, based on what you understand about some concepts, here in the US, comparing races, we talk a lot about health inequalities, but I don't think we are measuring them well, because we don't even account for differences when asking them questions. Flavio, I see you have your hand raised, so please go ahead.
Yes, Professor Ester, I'm from Brazil. Me and some friends are researching social capital in consumer behavior specifically. So the first pilot study, we were looking for how to measure social capital among consumers and how this relation can be understood. And we perform a systematic literature review, and we found some items, and we developed a small scale, pilot scale, to measure social capital from the specific domain of consumer behavior. And when talking about this diff aspect, we believe that maybe this is happening because there are a lot of cultural difference among people and populations. And in some countries, this is more or less performed, viewed. You know? In US and Brazil and maybe in Europe with the aspects of ethnicity, maybe something that is stimulating this differential item functioning. So maybe if we collect more control variables, could be important to assess this moderator effect that maybe is causing this differential item functioning.
Yeah, I totally agree.
Particularly when cultural aspects are considered. Yeah, social capital is more linked to cultural groups. So ethnicity and aspects of cultural groups may be causing this differential effect, I believe.
Yeah. I agree with you, Flavio. And I think, so some solutions, I think this can have, well, not solutions, why this is happening. Wording of the items may cause some confusion for one of the groups. This can happen all the time. items may not be meaningful for one of the groups. So for example, I have some colleagues working here at Johns Hopkins and others working at Yale University, and we are all interested in this field and thinking about how to measure things better. And we were like, well, if you ask Blacks, for example, about voting, and this is something we have used a lot about, so I have seen many papers collecting data on percentage of people voting in an election. These may be something very important for whites, and maybe it's a good reflection of social capital for whites. But if you go to the community here near where I live, which is Baltimore, in Blacks, this is probably not a good indicator of social capital. Okay. And well, what is meaningful? Or for example, if you speaking with Black communities, they value a lot being in a neighborhood, for example, that is composed by people that do have businesses like shops and bars that are owned by Blacks, other Blacks. So they care about this a lot. So when asking these questions about trust or belonging or all these kind of things, I believe these experiences, this background matters a lot. And without considering these differences, it's very difficult. I feel it's very difficult to create item-free variables depending on the groups you want to compare. But it's true that there are ways to test for that. And I believe this involves a lot of mixed methods, right? So we have modern psychometric techniques to check that, but also qualitative methods, cognitive debriefings are super important when developing instruments and when you want to import some of the concepts or questions that are out there in the literature. I think it's very helpful to run some qualitative evaluations first, because you discover tons of new things. When you think that you have a super nice questionnaire, you go to the community, you implement, so you ask community members, potential participants, you ask questions about these questions, and you discover a whole new world. This has happened to me all the time. So, well, this is a summary of what I think why DIV is happening. And I believe, well, DIV can be very difficult to revise and to prevent. It's something that I said. So qualitative research, I believe, as I said, is crucial at this point to see the differences. And the implications of finding DIV depend on the intended use of the scale. So if scholars would like to evaluate changes within individuals over time, as opposed to comparing results, I believe DIV is less important. So, but if your objective as an investigator is more in measurement theory and you want to compare results among the groups, it's very, very important to have to avoid having DIV and controlling for DIV when using these scales. And this not only applies to racial DIV. As I say, there are multiple ways to find DIV based on group differences. So with all this, what I wanted to tell you is that what I have done in the past, because I was very, very frustrated during my postdoctoral studies some years ago while being at Harvard University with social capital measurement. So there were multiple definitions of social capital and many questionnaires and scales that could be potentially good for some populations, but not appropriate for others. So I was particularly interested in bridging social capital. And I'm from Spain, and I became very interested in evaluating bridging social capital in Hispanic immigrants here in the US. And as you probably know, because you all use the concept of social capital frequently now, bridging social capital is a very important resource for immigrants. Immigrant communities, especially when they first arrive in their countries of destination, can be socially isolated and tend to mix with other people that are similar to them. So they can have a strong bonding social capital, people with other immigrants, people from the same country, but they lack bridging connections. And this can result in a disconnection from the new norms of the society they live in, especially when they arrive. And I wanted to evaluate bridging social capital in this specific population, and I didn't find tools to do that because bridging social capital is quite specific, right? So I started the journey years ago that is still ongoing. So my objective was to start thinking about how I could develop these bridging social capital questionnaire, but for a very specific population. My aim was never to be like a bridging social capital questionnaire that can be used with any population, no, because I don't think we can do that. So I was super concentrated on Hispanic immigrants. So what I did was I have 3 papers related to this. One was published some years ago, which was more a review of how we had measured bridging social capital in the past. With this review, I ended up developing a bridging social capital questionnaire, and use here it's where I describe more the mixed methods. So all the qualitative piece, but and after some psychometric techniques that are more related to classical test theory, and a 3rd paper where I take the questionnaire, but I use more modern psychometric techniques to see if it works well or if it needs some more refinement. And with these modern psychometric techniques, I specifically evaluated diff among many other things. So let me go over this. What time is it? Okay, so let me go over this pretty fast because you can read the papers. So these are 3 papers that you can find in the literature. I think 2 of them are open access, so I'm not going to have any problem to read them. But let me just give you an overview of what I did. So for the first one, what I did was to perform a systematic review because, well, I needed to see how bridging social capital was evaluated. And I ended up with 23 interesting articles. But these 23 interesting articles, so what I discovered, but this wasn't new, was that there was a lack of a common definition and operationalization. Oh, this is very difficult to say for me. Operationalization of bridging social capital. So there was measurement without specifying the heterogeneity and homogeneity of people involved in social network relationships. And I found some approaches that were kind of helpful for what I wanted to do. And here is where I thought, well, let's think about if we want to have a bridging social capital questionnaire, what are the important dimensions a bridging social capital questionnaire should be evaluating? And here it's where I was like, okay, this is the concept. So this is more the model I'm going to be following. So I need to ask questions on all these different parts of bridging social capital that are important to evaluate for in this topic. So I ended up with a questionnaire. So we prepared a pool of items. I'm going pretty fast, but this was a super long process where we identified with my co-authors like different dimensions, and we put some items together, and we ended up with a questionnaire. The questionnaire is available in the papers that are at Social Science and Medicine Population Health. So you can check the questionnaire there. It's available as, I think, in the appendix of the paper. What we did was to develop this, thinking about being able to use the subscales independently. And we developed the questionnaire in the 2 languages simultaneously, in English and in Spanish. I know that the Spanish is the language that all the Hispanic community uses here, the immigrant Hispanic community, but still, I wanted to have it in English as well, in case, some people started being more comfortable using English instead of Spanish. So we did this simultaneously. These are some of the questions of the questionnaire, so you can check it. And super important here, without focus groups, so you don't really get to the point of if the questionnaire is appropriate, if it's useful, or what it is. So what happens here? So I involved people with different economic backgrounds. I went to the community, and I also went to, I interviewed some students, and I wanted to get a sense of, well, what's going on with my questionnaire? And I was very concentrated on the understandability, concepts being meaningful and appropriate, and questionnaire burden as well, because you don't want to have a too long questionnaire. And I believe the key question when checking if your question works well, if a specific item works well, is question B. Can you please explain the question in your own words? And here is where you say if people understand what you mean or not, especially with participants that have lower educational backgrounds, educational level. So we ended up performing many changes. So here is a list of changes, but I discovered something very interesting. So are you familiar with the name generator and the position generator and resource generator instruments? I'm sure that you have seen these questions in the past, right? So Tristan says yes. So I guess many of you as well. So what I did, one question there that we thought would be very interesting to have was the position generator. We were like, okay, let's give them a page and they can focus on existence of social resources within the networks and see what they have access to. This is very important for immigrants. So when I went to the community and I implemented a survey, I could see how people were trying to fill out the survey. Many people left the focus group when trying to fill out the position generator question. And I was like, oh, wow, so this is a very important question. I believe it collects very important data. But for those that are not super, that were trying to fill it out and think about, so for Hispanic immigrants, it wasn't a good question. And I would have never discovered that without going to the community, handing them the questionnaire and asking, please fill this out. So we had to delete that one. So it was an eye opener. I was like, oh my goodness. So this is a problem. So not all questions are appropriate for everyone. No, absolutely not. So this was a very important lesson learned in that the moment I was running these focus groups. After this, after performing all these changes, it's where I implemented the survey using Qualtrics in 138 people that were selected from a national database. And I used this sample to test psychometric properties, but only using classical test theory. So I'm gonna let you know about, so I was concentrated on reliability. So we measure reliability with Cronbach alpha. And we also check validity. In this case, I used, so I wanted to evaluate construct validity, and we use confirmatory factor analysis. You have other methods to do this, but I was concentrated on CFA, discriminant validity, and content validity. So I involved an external committee to check the questions to make sure that they looked good to them as well. So as I said, content validity is a key thing in any questionnaire. So these are some, this is some information about the expected parameters I wanted to see to approve the questionnaire and not delete anything. And what I did was so after some time, I went to, so Qualtrics, I used Qualtrics again to collect some more data. But in this case, the data was collected in the area where I live, in the Baltimore, Washington, DC area, because we were recruiting people from community centers we work with, and we gave them access to the survey, and we collected, so 224 people filled out the questionnaire. And in this case, I wanted to test the questionnaire in a different sample. And this time, what I wanted to do was to be concentrated on modern psychometric techniques such as DIF and others I'm gonna show you in a moment. So I don't want to go over the details, the methodological details of this, but it's pretty intense. To me, it's fascinating because you can discover many things about item functioning. So you can check the paper and you can see that we evaluated item fit statistics, thresholds, person separation index. It's something to evaluate reliability, which is similar to Cronbach alpha, but still, so it's a different method. You can check local dependency, differential item functioning. You know a lot, now you know what it is about. You check unidimensionality, and here I wanted to see if each scale was unidimensional and if we could implement each scale separately from the other scales that were part of the questionnaire. And you evaluate targeting and item locations. And I have some graphs for this one because I believe this is something that is super nice to see. So our results for the first sample were pretty good. So Cronbach alpha was good. So we were happy with this. The results of the confirmatory factor analysis were pretty interesting. So the results were telling us, okay, so you are following the construct, the model you developed at the beginning. So it has the dimensions it is supposed to have. But I discovered that all the items I had evaluating trust had two different factors. So the CFA told me, no, you don't have one dimension here, you have two related to trust. So I have some items that are asking questions more related to trusting immediate people, and others that are more related to trusting big institutions, corporations, and non-immediate people. So that's why the CFA already was telling me, okay, you have to separate them. They are measuring different things. Here, so it's just a summary of the results of the CFA. So you have, if the goodness of fit is good, if you don't have residual, so to not reject the model, so you have to check those. So they looked good. But when I implemented the survey, in this other sample, the second one, and I used the Rush model. The Rush model is part of the IRT family. So it's one specific model we use to test questionnaires. And what basically with Rush, if an item doesn't fit the Rush model, you have to think about what to do. You can change it. You can delete it. You have to do something because the Rush model is pretty strict. So if there is something that it's not working well, an item maybe is adding some noise or it's not evaluating what it is supposed to evaluate. Okay, so that's why in this paper I have version 1 of the paper. Version 1 of the questionnaire, and what I do in the third paper is to create a second version of the questionnaire after implementing the Rush model. So we deleted the items and made changes always, and this is super important, checking the qualitative information that we collected when we were developing the questionnaire. I'm a super fan of numbers. You can tell that I'm a super fan of numbers, but I'm a super fan of qualitative interviews as well. So before making any change to questionnaires, I go to the community or I go to my notes and I see if it makes sense. So avoid making changes to a model or something if it's not supported by theory or if it's not supported by qualitative evaluations. I think this is totally wrong. So here, this is just a small piece of a table of paper 3. This is table 3 in the manuscript. And it summarizes the Rush model analysis. And it shows the improvement in the model after deleting some items. And each row it gives information on each subscale of the questionnaire. But what I wanted to show you, which I believe this is pretty interesting, when I was talking about these person item threshold distribution. This is something we do with Rush. And this is something that I believe it's super informative. And I'm gonna finish very soon because I don't want to fry your brains at this. So after an hour talking about this, but so this is quite difficult. It gave me a hard time at the beginning to understand how it works, but I'm gonna do my best to tell you what we see here. So this is a specific subscale of the Bridging Social Capital questionnaire, and this scale is the socializing in the workplace. So in this case, the ability of each person to socialize in the workplace with people with different characteristics, because it's something we wanted to evaluate, is referred to as the person measure. And the ability required to perform each item with a certain level of difficulty is called the item measure, okay? So we examine the map of persons and items to compare the range and the position of the item measure distribution, which is the blue part of the figure. You see the blue part at the bottom, and the range and position of the person measure distribution, which is the red part of the figure, okay? So items should be located at each point of the scale to measure meaningful differences. So the items must cover all the areas on the ruler. So here you are, this is the ruler, okay? So the items must cover all the areas on the ruler if we want to measure the ability to socialize in the workplace with people that have different characteristics. So sorry, I didn't want to move this one. So what is helpful is to observe which items are in each place of the ruler and evaluate which items are easier, which are the ones on the right side, compared to the other ones that are more difficult, which are always sitting in the left side here, okay? So for example, mixing with people in the workplace that have different political opinions may be easier for Hispanic immigrants than mixing with people with different nationality in the workplace. So here the software, so you can check which items are these ones, okay? So you can check which one is easier, which one is more difficult. And basically what we see here is that the items, oh, sorry, this is moving all the time, I don't know why. So the items we selected cover most persons of the scale, okay? So here you have the people, here you have the items. So you want to see that the items are, that people do have several items here, because here, this is showing me that some items are too difficult, some items are too easy, and probably here I have a gap, okay? So we have persons with no corresponding items and items with no corresponding persons. I don't know if this is, so probably this is quite difficult to understand, but let me give you another example, which is gonna be related to a different topic. So imagine that you have a person with mobility issues and you have a questionnaire that wants to evaluate the functioning of this person, okay? So you have, how can I phrase this? So you have a condition where you have difficulties to move. And if you want to evaluate the level of functioning, probably you have three items. Let's imagine that you have one item that it's kind of, can you take a bath by yourself with no help? Another item, can you climb stairs with no help? Third item, can you walk a mile? All of them have different levels of difficulty, right? So if you can take a bath by yourself, okay, maybe you are impaired, but not a lot. If you can climb stairs, it means that you can take a bath. But if you can walk a mile, you can do all the other ones, right? So in this case, so we would say in this location here, we would have the item take a bath because it's easier. Here we would have the item climb stairs, and here we would have a more difficult item, which is can you walk a mile? Okay, so the items should cover people that have more difficulties or fewer difficulties. So here, what we do is to evaluate if we have items that are in the different level of ability, if they are more difficult or less difficult for the participants. If you have a gap, it means that probably you have to develop some items that fall in here. But imagine that you have most of the items in a couple of locations. It means that you are not going to be discriminating. You are not going to have enough information to keep to observe the variability of your sample when implementing the survey. So what I did was to put another one. You can check the paper for this. So all the graphs for all the scales are in the paper. And here, for contact with similar different people, which is another dimension of the questionnaire, well, many items are covering like different ability levels of the respondents. Still, some people, so we have a gap here and one here, so probably it's too difficult to endorse. But I was kind of quite happy observing that, well, I didn't have like all items following in the same location. So they are following in several places here. This is super helpful when you are using item response theory to see if you are really covering, if you have items that are not too similar. So you want them to be related to each other because all of them are measuring social capital, but you don't want them to measure the exact same thing because you are adding a lot of burden to your participants answering the questions, right? So you want to get a lot of information, but with fewer questions. This is a way to observe that, okay? Okay, I'm finishing here. Discussion. So bridging social capital is super important for Hispanic immigrants, and I really wanted to have a measure to evaluate that I'm implementing now to build some evidence about potential interventions to build social capital for the Hispanic community. But one important thing, and it's a key message here, is that it's very important. So when you are targeting your measures, it's very important to keep in mind all the different things I talk about to avoid bias when collecting data. It's a very difficult task, but we have to do our best to do that. Careful when you are using questionnaires that have never been tested in your target population. Because if there are differences, probably questions, so if there are cultural differences, the question is not going to work the same way, the way you expected. And very careful when comparing the results. When we saw the differences, differences, probably we cannot compare the data I have about trust. Probably I cannot compare blacks and whites with those. Limitations and strengths, always many limitations. I only put a couple of here. Selection bias is one, test retest. So I always want to see if a questionnaire can evaluate change or if it's stable. In my case, I want to see if it's stable. So what I usually do is to implement the survey 2 weeks apart or a month after to see if the responses are similar to the responses for the first time the people filled out the questionnaire, to see that it's really reliable. This is called test-retest reliability, but I couldn't do that. This is something that I should do at some point. And I believe some of the strengths of this work is that, well, we have a measure to evaluate bridging social capital that included mixed methods and a culture, and it involved the cultural development. And the good news are that subscales can be used independently based on all these tests we perform to see if really the subscales can be used independently. I don't want people to take only some questions of my questionnaire if I don't know if they can be used in isolation. Now I'll be super happy if someone tells me, "Well, I want to use your questionnaire to test if the questionnaire can be used not only in Hispanics. Maybe we can adapted for other uses, or maybe not for immigrants. So I'm sure that there have to be some changes, but I think it's a good base to adapt it to other potential evaluations. Conclusions here. Check your scales, questionnaires, tools. Remember your population target. Run some tests before analyzing the data. And this is not difficult. So I always try to, so if you start using some softwares for psychometric properties evaluation, you can run Cronbach Alpha, or you can start using the graphs like the Rush I showed you, or the deep ones, to see if you really can use them without many issues. So this is something that I do all the time before running some analysis to see the relationship of social capital with the health outcome. I want to say if this really works well. And in case you are collecting data, please, 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 qualitative evaluations first, because you are gonna learn a lot. So the part on the position generator and all this stuff, so this was a super eye opener for me. I was like, oh my goodness, I was super happy with this question. No, I couldn't use it. Acknowledgements, my colleagues from Ichiro Kawachi from Harvard, Yusef Ransom from Yale, Ana Maria Rodriguez from McGill University, and Ines Adams from Harvard. All of them have been part of this work. I never work alone, of course, so all these colleagues have been super helpful to me and being part of this journey. And thank you very much. Please send me an email. I'll be happy to respond. Or if you want to read the papers, if you don't find them, or if you want to learn more about psychometric techniques, measurement of social capital, I'll be happy to chat with you.
Oh, thanks, Esther. It certainly is a fascinating and really important topic that we need to deal with. We all want it to be so easy. It'd be so great if we could just go and measure social capital with a really simple instrument and it was the same in every context and we could just do it. But as you've highlighted, it's really not the case. It's far more complex and complicated than that. And we need to take on board some of these kinds of ideas and lessons in validating the ways in which we're measuring social capital if we're to get meaningful and reliable results from our research. And so one of the most surprising things that came out of my survey of the literature was the very small rate of mixed methodologies. It was 7%.
Yes. Yeah, that surprises me a lot because with questionnaire development, I believe without mixed methods, it's impossible to have a good measure. This is exactly what I think. And I do I think now there is a lot more, so people are more aware of the need of asking the community, potential participants. This is something that here we have some mechanisms. So we have a lot of advocates for including like people that do have a disease when we want to evaluate some specific stuff. So they are the experts of so more than us, right? So we need to include them. Now I'm talking about patients with a disease because I work in the School of Pharmacy and we evaluate drugs and so on. But it's not only that. For social capital, if we don't go to the community and ask them about the questions we ask, I cannot know if this is something that is appropriate to them or not, right?
Yeah, absolutely. And I'm a qualitative researcher myself. And so for me, mixed method makes perfect sense because I can develop an instrument and I can ask people what they think it means. And then I can adapt that instrument to actually get to the information that I'm looking for. And from my own experience, the things you've said about particularly language and values and how things are interpreted is so important because I've had conversations with people where I've used a word and because of cultural differences or value differences or language differences, they've misunderstood what I meant by that word. And so you can end up with people responding in altogether different and even in an opposite kind of way to what you're looking for, the data you're looking to actually get just from the wording of a question. And so therefore, that really highlights, I think, for me, how if we're taking a survey that's been developed for a particular population and we're applying it in a different context, how we might be getting vastly different kinds of information and results.
Totally agree, totally.
So I don't want to dominate the questions. Obviously, there's a lot we could discuss. So I'll open it up for questions from the audience. If you could use the raise hand tool within Zoom, you can find that under the reactions tab at the bottom within Zoom. If you can raise your hand, we'll try and get through your questions. Esther, how long do we have? Do we have another 15 or 20 minutes?
Yeah, I have 15 minutes.
Okay, so Marion, are there anyone in particular who we should get to first? Otherwise, please raise your hand in Zoom and we'll try and get to you. If you're watching live on YouTube, pop a question in the chat and I'll try and get to that as well.
Okay, I think
Tristan, I think the only person that may not have had the question answered is Aminul, but I've checked that everybody else, I think, has actually had their questions addressed.
Okay, Aminul, would you like to ask yours? Anyone else, feel free to put up your hand and we'll try and get to your question. Not sure Aminul's here. Orlando, did you want to?
Aminul's here.
Oh, Aminul, are you ready?
He's just not speaking yet.
Yes, thank you very much.
Go ahead, Aminul.
We're having trouble hearing you.
You're muted again for some reason.
Oh,
go now.
Thank you. Thank you very much. I have sent my question to the chat box. Is social capital measurement or social capital assessment is same thing?
So is social capital assessment and measurement the same thing? So that's the question, yeah.
Yes.
If social capital assessment is the same as social capital measurement, is this the question?
Yeah.
Yes.
I believe so. I don't know. So now I'm thinking about if we use the terms interchangeably. Probably yes, right? What do you think, Tristan? Yeah.
I think so, unless we're coming down to a technicality that an assessment isn't research, perhaps.
I was trying to think about differences, but at this point, no, I don't have any. I would say that, yeah, they are the same.
Yep.
Thank you.
All right, thanks, Aminul. Should we move on? Next question, I think, is Orlando.
Yes, thank you, Tristan. Hi, everybody. Hi, Esther. Thanks for the presentation. I really enjoyed it. So I have two questions. The first is about how can you make differences between different populations when you develop an assessment or a metric that is tailored towards a certain specific population group. In your case, I understood the instrument was developed for immigrants, for Latino immigrants in the States, but let's say at some point you want to see the difference with no migrants population, with other people. And of course, for measure the social capital in those other population groups, you might need another instrument. So how you do handle that? How do you solve that puzzle?
Yeah, imagine, if I am understanding your question well, so you are asking that if, for example, if you want to implement the survey, the questionnaire in a different population, for example, Hispanics that are not immigrants. So how can I do that? Is this your question more or less, or?
But more importantly, how can you, if you find any differences after the two surveys, how can you make the case that the differences are real, even though the survey was designed for one group and not for the other?
So the differences are real. If running some tests, you want to know differences are real, right? Well, yeah. So I believe, as I said in the presentation, I love numbers, but I love qualitative evaluation. So if I find something that doesn't work the way I expected it to work, it's when I have to go and ask why this is happening. And this is where qualitative research is super important and useful. So imagine that now that I found these problems, specifically measuring trust, and I believe trust is something very important. And now during a pandemic, I realized that trust is even more important than I thought. And I thought it was very important. Now in the middle of a pandemic, that we do have a lot of trust issues, specifically in this country and probably in many other locations. So the way we measure trust is very, very important. And the only way to know how to ask how to phrase questions related to trust is to start like with not with cognitive debriefing. I think it's more concept elicitation. So how we create surveys related to this specific thing. So I haven't evaluated other surveys that evaluate trust, but I would be very interested to observe if what I'm having, the issue I identified in the specific questions I showed you, is reproduced in other samples or in other ways to ask for trust, because I do think that trust is a concept that can be very tricky to ask. But there are, for example, community participation. So community participation is very different in different groups. So you cannot compare information about community participation if you have people with within different age groups, or so this is something that you have to figure out how to deal with this. First, asking your like community members, potential participants, about how to deal with this.
Okay, thank you.
Orlando, do you have a second question?
Yes, my second question is that let's say you know the kind of outcomes you are studying. In your case, for example, something about health or epidemiology, and you want to see that. I know. Let's think about mental health or something like that. Do you think that if you know the path of causality and the outcome that you want to study, then you should reframe your social capital assessment in order to shed light on the causality or on the issue?
I'm not sure I'm understanding your question, Orlando. So you're talking about causality, so that to evaluate. If I would change the way I ask questions about like social capital questions, if I want to establish causality with health-related outcomes, for example?
Yes, for example.
I have never done that, I believe. So I'm not sure I have a good answer for you, but so this is food for thought to me, because to establish causality, well, basically what I do, so for causal inference, I believe the way to collect, the way how we collect data is the tricky point here. For causal inference, I realized while being at Harvard and being part of some courses on causal inference, so you need very specific data to be able to use some methods on causal inference to establish, to see if there is any causality and so on. So I always very careful about talking about causality, because I think it's a very tricky part. But it's true that I try to use panel data, having follow-up studies where I can compare, but still it's difficult to say if there is reverse causality or what happens first, right? This is something that happens all the time. Sometimes it's like, wow, what is, so you don't have this health outcome if you don't have social capital, and the reverse way, right? So this is a tricky thing. But I believe, well, thank you for this question, because I'll keep thinking about this.
Thank you.
And really, causality with quantitative research is incredibly difficult because social capital is so multi-dimensional. In science, in laboratory research, we can control for various factors and we can identify down to just a causal relationship. But in social research, it's not possible. Yeah. Well, it's very, very difficult to identify any kind of causality. And so I would say, broadly speaking, if you're interested in causality, then you probably should be looking at qualitative research, because it's more suited to asking questions of why. Mm-hmm. But that's I always invite my colleagues at the pharmacy school where they give a pill to a person and they see if there is an effect, right? I cannot do that. With social epidemiology, it's extremely difficult. Yeah. We should move on to the next question because we're running short on time. Flavio, I think you're next. You have your hand raised.
Okay, thanks a lot, Mr. Tristan and Esther. My question is regarding the dimensionality of social capital. We are today discussing how to measure social capital, and I would like to know about from Professor Esther if social capital has that dimensions, and if that dimensions are took for granted, and if we can search for new dimensions for social capital. And the second question is whether we should look for social capital measures from specific domains. From I'm interested in consumer behavior, but maybe some colleagues may be interested in other areas of knowledge also. Thanks, thank you.
Okay, I had problems hearing that one, but those questions, but you were asking about dimensions, right? So it's a multi-dimensional concept, and a multi-dimensional concept with a lot of complexities. Of course, there are multiple theories on social capital. So depending on if you read social capital literature that is coming from an epidemiologist or from a sociologist or from a political scientist, probably the dimensions are going to differ a little bit. And so it depends on your background, how you conceptualize the concept. To me, one thing that we do a lot in public health is thinking about social capital more at the individual, but also at the collective level. So it's a multidimensional concept, but also it's a multi-level concept. So this is something to keep in mind as well, at least for me, that I do population health research, right? So for the second question, Tristan, did you understand? Because I have some.
No, I didn't hear either. Flavia, would you like to repeat your second question?
Or if you want to write this down.
My question was whether those dimensions of social capital must be took for granted, or if we can follow up for new dimensions for social capital when we're looking for specific domains of knowledge.
I think the life is changing all the time. I never take anything for granted. So why not? So we should review our theory all the time. Why not?
I think this question really comes down to that fundamental question of what we think social capital actually is. And I think there's a lot of different interpretations of that, and there's lots of different ways we can organize our thoughts into dimensions. I think everybody acknowledges it's multi-dimensional, but different people take different approaches to organizing the way in which we think about this into dimensions. And so while a few approaches to dimensions have come up as being popular or common, I think I agree with Esther that we should continue to consider this to be an area that needs to be explored further, and different things may come up.
Thank you so much.
Move on to the next question. Saikuk, I think you had a question.
Yeah. Saikuk Tariq, I did my PhD on the social capital in the supply chain management. So I have many questions about the social capital, because since 2013, I didn't answer all the questions. So I have one question specifically concerning the topic of your presentation, and I would like to thank you, Esther, for this clear presentation, and also thanks to Tristan. My question: we can use the same measurement or assessment for the dark side also of the social capital, because I do believe that the social capital, we have some problem in the conceptualization of the social capital. All the definitions, they consider that the social capital is all the time positive. But I do believe that the social capital could have more dark side or shadow. We have the shadow of the social capital, something that we ignore about the social capital. Because
we don't ignore it.
Because all the work of Coleman, Bourdieu, because I'm more attracted by the definition of Bourdieu, who considered the social capital in its instrumental or strategic way to use to use the social capital. So I make the difference between the social capital as a potential and the mobilization as the like social influence, like a strategy of the social agent to realize the objectives. So my question about the duality of the social capital, the bright side and the dark side, and if we can use the same dimensions or the same measurement scales for the two sides.
Yeah, so probably you are super familiar with the work from Portes, right? I think he's in Princeton. So he has literature on the dark sides of social capital. And I do have a paper on the dark sides of social capital as well. So I'm really aware of the dark sides of social capital. And what I did in my paper was to review the typology that Portes created and see, based on the literature that was demonstrating some negative associations, negative effects of social capital, if there were some categories missing. And there are a lot of papers that found associations that are negative. These can happen, but for example, now I'm writing a paper on social capital during the pandemic. And what happens with if you have bonding social capital, a strong bonding social capital? The spread of misinformation goes super fast because you trust some people from your like your colleagues, your family. They share some vaccine hesitancy with you, and you end up saying, oh, maybe I'm not gonna. So this happens. So these are the dark sides of social capital. So bonding social capital is not always positive. The other thing, for example, is caregiving. So you may have a big network, so you have a lot of social capital, many resources, but this means that maybe you have too many demands on you. So people are asking you for support. So having all these network maybe is impacting your health as well, because, well, people are asking you many favors. They are asking you to support them all the time. All these things have happened, and I have multiple examples on this. So I think social capital, oh yes, it has bad ends as well. And I think, check this paper I just mentioned on the dark, I think it's called The Dark Sides of Social Capital. It's a systematic review. Check this, because you will see that there are multiple. So basically I give like different examples, and the typology is giving you a way to categorize so the dark sides of social capital depending on the findings you end up with.
And my question was also about if we can consider that the bright side is always before the dark side, or the two sides are in some coexistence.
This is kind of difficult to respond because in my case, well, let me give you an example, and probably you are going to answer the question. So imagine that you end up in high school. So you are 15. You go to a new high school and you start making many friends. So you have like strong bonding social capital. You are part of a nice group. But this group, you just met them. You go out with them on a Saturday and they binge drink and they smoke a lot, right? What do you think? This is the dark side of social capital. There is some behavioral contagion, right? So it's behavioral social contagion. So if there is this, if these people do have strong bonding social capital, but they use it with bad ends, like binge drinking, smoking, whatever, using drugs, well, they cohabitate, they happen simultaneously.
So thank you for these answers, and I hope that I can all the time participate in your presentations. So thank you.
Thank you.
I think we have a last one, Joseph.
Let's have one last question, Joseph, and then we're out of time. Joseph, did you want to unmute?
Yeah, Yeah, sorry about that. I was just going to add to Orlando questions. Maybe this is a remark. So I think what we, in terms of social capital, I think that idea of context specific, I think is so crucial. So, being in the United States, I come from Africa. When I look at the two societies, the really deep individualism here in the West, given, the collective life in the Africa, is there's no way that you can do, you can evaluate this, concept using the same instrument.
Yeah.
And now back to the bonding social capital. I think, in line with that individualism too, social capital is really used to exclude, especially in the United States, when we talk about the relationship between different group here with a different power, labels. Social capital become an instrument for excluding others to participate in the community life and share resources. So I'm just going to stop there.
Okay, thank you. I believe those that live in Africa or so places where I think social capital is super important as well, but the reality is very different. I really encourage you to adapt questionnaires to measure social capital in there. I don't think it's a good idea to use the questionnaires we use in other settings. Your reality is kind of different. And probably the way you ask questions about trust and the way people understand questions about trust can be super, super different. So it's the context here is the key. So that's why exporting these questions, it's not always a good idea. Maybe it's a good base to start with, but you have to identify how to ask for, how to change those questions or make sure that they are meaningful to your community.
Right.
Wow.
Same thing with food security, right? So food security, is as a scale, right? They have this scale developed to measure food security. Then when they took it back to the developing country, they found that it doesn't work that way. Now they had to modify food security measurement to capture that reality of, contextual reality. Yeah.
Yeah. I agree with that.
Well, this is clearly such a big topic. There's probably many more questions and much more discussion. And it seems like there's an enormous demand for this. So I think a bit more work needs to be done on this, and maybe we can run some more sessions that deal with these kinds of issues. I think everyone needs this. Everyone needs these kinds of solutions and to basically improve the quality of the research that we've done. And Esther, thanks very much for the presentation. I think what you've shown us really gives us a lot of ideas about how we can do that, how we can improve our questionnaires and the validity of them as well. So we really appreciate your time.
Thanks a lot for the invitation.
Thank you. So our next session in a week from now is going to be an informal discussion group session. So the event is listed on the website and on the Facebook group. Everyone's welcome to attend. There's no real structure. It's really about bringing along questions and ideas and discussing research and whatever it is you want to do. And then the following week, we have a presentation by Elizabeth Costello, who's going to be talking about mobilizing social capital through social accounting. So again, that's listed on the website. So we'll end there. Thanks again, Esther, and thanks everyone for attending and participating, and we look forward to the next one.
Thank you very much.